This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Tuesday, March 2nd. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on and appreciate you staying with us on Africa 54. We begin with good news from Nigeria. Gunmen have released all 279 girls kidnapped from a boarding school in northwest state of Zamfara, according to the state governor. Freed schoolgirls were reunited with their families on Tuesday. Earlier reports indicated that 317 girls from the government girls' science secondary school in the town of Jangebe were abducted by an armed gang at around 1 a.m. on Friday. Zamfara state spokesman Sulaiman Tanau Anka told Reuters that some of the missing girls had run into the bush at the time of the assault, and the number of those kidnapped was 279. All have now been freed, according to Zamfara Governor Bello Matawalle. Most of the girls appeared to be unharmed, but at least a dozen were sent to hospital for treatment. The girls were mostly barefoot and several had injuries to their feet. Boarding schools in northern Nigeria have become targets for mass kidnappings for ransom by armed criminal gangs, a trend that started by the jihadist group Boko Haram and continued by its offshoot Islamic State West Africa province. The Zamfara raid was the second such abduction in little over a week in the northwest, a region increasingly targeted by gangs. Governor Matawalle said repentant bandits working with the government under an amnesty program had secured the release of the Jangebe girls. The new chief of the World Trade Organization, Okonjo-Iweala, urged its member states on Monday to work with pharmaceutical companies to license more COVID-19 vaccine manufacturing in developing countries in order to triple global production. Her call comes as a group of developing countries led by South Africa and India seek to waive intellectual property rights for COVID-19 drugs and vaccines, a move opposed by the United States, the European Union, and other wealthy nations. In West Africa, Cote dIvoire has launched its first COVID-19 vaccination drive with COVAX doses. Africa 54 health correspondent Lino Mudu has more.
Cote d'Ivoire on Monday began inoculating frontline healthcare staff and police with COVID-19 vaccines. The country received 504,000 doses of the AstraZeneca Oxford vaccine on Friday, delivered through the COVAX sharing facility. Dr. Atanasia Undri was one of the first to receive a shot.
I'm relieved for having just received the vaccine, since it is the price to pay to push forward and reduce the illness.
Cote d'Ivoire plans to roll the vaccines out to medical workers, security force members and teachers before vaccinating people over 50, those with chronic diseases and travelers. The West African country, along with its neighbor Ghana on Monday, became the first countries in the world to administer vaccines from COVAX.
We hope there will be more and it will speed up. We invite the population to come and get vaccinated, because to get vaccinated is a way of breaking the transmission chain.
COVAX is an initiative led by the Gavi Vaccines Alliance, along with the World Health Organization and other partners, to provide equitable global access to the COVID-19 vaccines. The initiative aims to deliver nearly 2 billion doses to over 90 low- and middle-income countries free of charge, covering up to 20% of their populations. In Cote d'Ivoire's capital, Abidjan, more than 100 people waited patiently in line at a sports complex in the Trècheville neighborhood early on Monday to receive the first shots of the vaccines.
Seeing the vaccine arrive is comforting. It is a relief. It will impact on social development because everything has slowed down. Nothing works at the moment. So if today everyone gets vaccinated, we won't be scared anymore. And when the illness is neutralized, things will take off again as before.
Africa has reported relatively fewer COVID-19 deaths, just over 102,000, compared to other continents. But the toll is rising as a second wave of infections overwhelms the hospitals. Ivory Coast has had approximately 32,000 cases and about 192 deaths. Linor Moudou, VOA News, Washington.
After an erratic start, the largest vaccination effort on the African continent has finally begun in South Africa. VOA's Anita Powell walks us down the long, winding road that is bringing hope to millions.
It took a year, but now a future looks possible. South Africa only started rolling out the coronavirus vaccine in the last 2 weeks, but President Cyril Ramaphosa says they've taken off running, with more than 67,000 health workers inoculated in the first 10 days as part of the first stage.
The start of our vaccination campaign has so far gone extremely well. It has shown that we can achieve much when we work together as a government, the scientific community, the private sector, and community-based organizations.
The second phase will start as soon as late April and will include the elderly, essential workers, and those who work or live in institutions, and those with other health risks. In all, South Africa hopes to vaccinate 40 million of its nearly 59 million people. Dr. Richard Lessels, one of South Africa's top viral researchers, says he thinks authorities made the right move in stopping use of the AstraZeneca vaccine because it was not found to be entirely effective against the highly contagious variant that has driven most of South Africa's new infections. In all, the nation has seen more than 1.5 million confirmed cases. And he says South African regulators are looking at other vaccines, including those made in Russia and China.
Clearly, there was a lot of concern about us being late to the party and late getting started. The reality, however, is that whether we'd got started earlier or not, the vaccination wouldn't have impacted on that second wave that we saw, that really dreadful second wave, because that was already in motion in December. What's critical now is to get vaccine into as many people as possible before any resurgence and any possible third wave.
He also said researchers are working to develop a vaccine against the highly contagious new variant. In Johannesburg, the nation's economic hub, residents had mixed feelings about the vaccination campaign.
This vaccine is going to help us for this virus of coronavirus and what. It's going to help us, this vaccine. Because many people here in South Africa died because of this virus.
I don't think I'll be taking the vaccine anytime soon. Regarding why I say so, it's because of the fact that it hasn't been proven anywhere else in the world. If we had to be the first people in South Africa to be taking this vaccine, what does this mean to us as South Africans in general? Why can't we also be like the other world, wait for the original vaccine that should be given to us as people in this world so that we can also be safe from this coronavirus?
The Rainbow Nation has a long road ahead, but, says Ramaphosa, this is a country that has known hardship.
So much has changed in our country and in our lives. But the spirit of our people has not changed. You have endured the greatest hardships, but you have remained resolute, united, and hopeful. Now, a year after the virus first reached our shores, we have a much clearer path towards containing infections and ultimately overcoming the disease.
Shot by shot, he says, they'll get it done. Anita Powell, VOA News, Johannesburg.
3 new cases of Ebola have been confirmed in Eastern Democratic Republic of Congo, bringing to 11 the number of cases since authorities declared a resurgence of the virus last month. In a separate outbreak of the disease in Guinea, the World Health Organization said 2 new confirmed cases have emerged, bringing the total to 17 in the first resurgence of the virus there since the world's worst outbreak in 2013 to 2016. In Congo, the new cases were detected in the Butembo Health Zone, according to Eugene Nzanzu Salita, the health minister of North Kivu province. United Nations data shows Africa's Sahel countries have the highest rate of child marriage in the world, with more than half of all girls being married before the age 18. Henry Wilkins reports from Burkina Faso on a former child bride who fled her 54-year-old husband and now mentors other child marriage survivors.
In the Sahel region's semi-arid lands that skirts the Sahara, countries like Burkina Faso have the highest rate of child marriage in the world. Vivienne Sawadogo, whose name has been changed to protect her identity, lives in Burkina Faso, where the UN says more than half of girls become child brides. Her family forced her into child marriage at 12. Sawadogo had been promised from birth to the man's family in exchange for a child bride his family had given to hers some years earlier.
Quand j'avais 12 ans, je faisais la classe de CM2. On m'a donné en mariage à un homme qui avait...
I was married to a man who was about 54 years old. He had 4 wives and several children. I felt terrible because I had a strong desire to continue my studies rather than get married so early.
Une forte envie de continuer mes études que de me marier aussitôt.
So I decided to escape this curse. One morning, I left the house and walked from 8 a.m. to 11 p.m., over 30 kilometers. Sadly, I was caught and taken back to the house. I was completely devastated, but I didn't give up. I made another attempt, and that night, I walked more than 40 kilometers before I found a bus to escape.
After her escape, she found refuge in a centre set up by a church for girls fleeing child marriage. She lived here for 10 years and was able to continue her education. She is now a 22-year-old university student. She has left the centre but returns regularly to mentor younger girls, like this one who also escaped through the bush alone and whose identity we are protecting.
I left the man because I didn't love him, and also he already had 3 wives and children. I have been here at the center for a few months. The center helps me with clothes, food, and also I am at school, which makes me very happy.
Cultural practices like gifting daughters to other families are common in the Sahel, as is the kidnapping of young girls for marriage. But one traditional leader in Burkina Faso says poverty is at the root of the problem.
Le fait que les filles sont données en mariage, c'est parce que les parents pensent qu'ils n'ont pas de moyens.
A need for money is a reason for people to marry their children off before the age presumed right for a girl.
Non-profit groups like Save the Children are working to eliminate child marriage, but say financial support and empowerment of the girls is an essential part of stopping it.
We believe the reasons the girls are given up for marriage is because the parents think they do not have the means to support them. For us, when a girl is given in marriage, we have to find a way to empower her.
Save the Children provides cash handouts to families to ensure girls continue their education, while Burkina Faso's government says careful monitoring by citizens is also essential to prevent child marriage.
Le Burkina a mis en place au moins 800 cellules de veille dans au moins 812 villages.
Burkina Faso has set up more than 800 watch cells in at least 872 villages to carry out communication and prevention actions. For this, we have sensitized no less than 4 million people on the phenomenon of child marriage.
But it is an uphill battle. The nun who runs the refuge centre for girls says the conflict raging across the Sahel since 2012 has only made matters worse.
This week alone, we welcomed 4 girls. There are weeks when 6 arrive, which is too much. There are already 110 girls. We thought the number would decrease, but it is worse.
Despite the obstacles, Sawadogo says escaping child marriage is vital.
My life would be miserable if I was still in that marriage. Over the last decade, I would have already had 3 or 4 children.
Henry Wilkins for VOA News, Burkina Faso.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, a new social media platform that is exclusive. We'll be right back.
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. What are the main health concerns in Africa and around the world? Find out the latest on coronavirus. Connect with our experts and ask them questions.
How long does the virus stay?
Join me, Linoch Mudu, in Washington, every week on Healthy Living, right here on VOA.
Welcome back to Africa 54. The consumption of fentanyl-laced drugs is on the rise, and so are the deadly overdoses in the U.S. VOA's Veronica Balderas-Iglesias sheds light on an epidemic that the pandemic has shoved into the shadows.
My husband just passed, so it's kind of I'm still trying to get through losing him in daily life.
An overdose took the life of Victoria St. Arnold's husband. For decades, he had used prescription drugs and opioids to ease the throbbing pain from a series of spine surgeries.
I'm assuming he thought that he had just gotten some normal pills. It turned out that it was actually fentanyl.
100 times more potent than morphine, the synthetic opioid fentanyl has expanded its deadly presence in the United States. Just a couple milligrams of fentanyl, like a few flecks of salt, can kill. But mixed with heroin and methamphetamine, it's a huge profit maker for illegal drug dealers who sell it without the user's knowledge.
Because fentanyl is going to make people more addicted to those drugs, and it's cheaper, it's potent, it's more stronger. We're seeing a lot more drug overdoses as a result.
In the 12 months ending last July, more than 86,000 people had died of an overdose in the United States, officials estimate. That is up 24.2%. And in the nation's capital, a shocking 60% increase in overdose deaths in 2020. Psychiatrist Dr. Nora Volkov says the COVID-19 pandemic has made things worse.
Stress is the strongest predictor about whether people are going to take drugs. And what is stressful? The social isolation that we live on, the loss of jobs, the downturn of the economy. It is easy to fall into behaviors that temporarily make you feel better.
Corey Cusimano lost her son to an overdose in 2015. She runs a grief group, Social Distancing Required. She says families can't always afford the medication to reverse an opioid overdose or pay for long-term drug treatment.
Rehab is very expensive. It's anywhere from $6,000 to $14,000 for a 30-day inpatient program. And then after that, they can go into sober living, but they're almost kind of left floundering after that, and there's not that same level of support there.
Now, with the risk of spreading the coronavirus, it's more difficult for people with addiction to get help, especially the poor.
The human factor has been taken out because now people have to use mechanical devices, virtual platforms, in an effort to connect with services. Oftentimes they don't have sufficient internet access, and even sometimes the knowledge of how to do that. So it's become very impersonal in a genre that requires human touch and human contact.
In a statement to VOA, the White House says the Biden administration is working on solutions based on science and evidence to expand the addiction workforce and fixing racial disparities in drug policy. Also, drug enforcement agencies are scaling up their prevention campaigns and community outreach.
Starting with school-age children, if they learn early on all the risks associated with these potent lethal substances, that's going to cut off the demand for these substances. It's about prevention, it's about treatment, and it's about enforcement.
It's also about mental health, says Victoria St. Arnold. Families that risk losing a loved one to drugs need to be tough but compassionate and to take care of themselves as well.
Often they really hate themselves because they know how much they're hurting the people around them. I think they need to know that they're loved, but you still have to be firm. You can't just allow certain behaviors because it's harmful to everybody.
Veronica Valderas Iglesias for VOA News, Washington.
Last month's arrest of one of Asia's most wanted men, Suchilop, may have dented Southeast Asia's multi-billion-dollar drug trade. But with major money to be made, the cartel's main product, methamphetamine, keeps flowing, and Thailand is on the front line to stem that flow. Vijitra Dwangdi reports for VOA from Bangkok.
Highly addictive and cheaper than ever. Record amounts of methamphetamine are pouring out of the drug labs of the Golden Triangle, which straddles the borders of Laos, Myanmar, and Thailand. Asia's drug lords make up to $70 billion a year, trafficking their illicit cargo. Thailand is a gateway to the biggest drug markets of Australia and Japan. Thai police are making record seizures, especially of the highly addictive crystal meth. Unlike their Latin American peers, Asia's drug barons shun the limelight. But in January, Dutch police arrested Suchilop in Amsterdam. He is dubbed Asia's El Chapo after the Mexican drug lord. Officials hope Suchilop's capture will break open the secrets of a trade dominated by a shadowy syndicate known as Samgor, or the Company.
Samgor is really likely the largest group that engineered the shift we've seen underway in the drug trade in East and Southeast Asia, Australia, and New Zealand over the past half dozen, 7-8 years, where there's been this massive surge of crystal meth hitting the region. Behind that surge was very tight, well-controlled organization that functioned in a way that we hadn't seen before, essentially as a business network, bringing together different skill sets.
Samgor's number 2, Lee Chun-chuk, seen here in police photos taken over 3 decades, was arrested in Bangkok 3 months before his boss. He is fighting extradition to Australia on drugs charges.
เพราะฉะนั้นเมื่อหัวหน้าแก๊งถูกจับทั้งลีชุนชักและก็
When gang leaders Lee Chung-chuk and Suchilop were arrested, there was a level of disruption to the transport of large shipments of drugs to Australia, but it will only be temporary. The characteristics of the drug trade are that when the heads are cut off, there'll always be someone rising to the top spot.
ตอนนี้ในแก๊งนี้ก็ยังมีอยู่บ้างที่มีตัวรองๆมา
For Thailand's drug police, that means the work never stops. But the syndicates also adapt fast, churning out meth, splitting profits with international gangs, and laundering cash through casinos, condos, and cryptocurrency.
Samgor's difference is it's almost like a disruptive business model. They, in a sense, worked across groups, networking together different groups with the same common interest of making a lot of money. So they brought together all those different skills and interests.
Thailand counts the human cost of the drug trade in addiction and crime. Akaraset Chaweng Shinawong, a former crystal meth addict who runs therapy sessions in Bangkok, says oversupply is driving down street prices.
ในอดีตมันคือยาสำหรับคนที่พอจะมีกำลังทรัพย์
In the past, ice was used by people with money, higher social status. Now, due to its cheap price, it's reaching the middle class and below.
มันกำลังจะเข้ามาสู่สังคมระดับรากหญ้า
Akara said addiction robbed him of a happy life. After rebuilding his health, he has a stark warning for those toying with trying the drug.
If you haven't done it, that's a gift from God. Cherish it.
เพราะฉะนั้นก็รักษาพรนี้ไว้
Wititra Dungdi for VOA News, Bangkok.
There's a new player in the social media web space. It's called Clubhouse. But unlike other social media platforms, this one isn't open to just anyone. Maria Pruz looked into why the platform got so popular so fast.
New York Times best-selling author Rahaf Harfoush is hosting a discussion on a new social media platform called Clubhouse. She spends at least 2 to 3 hours a day there, hosting 3 weekly shows, co-hosting others, and listening to others still.
There are chefs and movie producers and entrepreneurs and artists and writers and athletes, and everybody is like finding their own group, and everyone is thinking about how they can contribute.
Harfoush says the most interesting discussions happen in closed groups, but even in open rooms, there's plenty to listen to. Shows hosted by people like Elon Musk, Mark Zuckerberg, or Jared Leto.
Thanks for inviting me up. It's good to hang with all of you.
All right, Vlad. What really happened? Give us the inside scoop.
The network is invite-only and for now is only available on iPhones. The platform doesn't allow recorded discussions unless the speaker gives a special permission to have the talk recorded. However, the users violate the rule way too often. In recent weeks, the number of Clubhouse users skyrocketed from 600,000 to 8 million, pushing the company's value to $1 billion.
This really enables people to have a real-time audio experience, much like a group chat, like over voice, but you might be connecting with people you don't know yet, or you might be connecting with existing friends.
Ouyang has so far counted almost 30 similar Clubhouse competitors, and by the end of the year, he expects there to be more than 100. One big downside is privacy issues. Users should always assume they're being recorded, but that's not all.
For example, online bullying or misinformation or other nefarious acts, or people just committing scams that could possibly lead people astray, let alone false information being spread even by foreign state actors and from every potential location on the globe.
For now, Clubhouse is free, but experts say in future the company might consider premium accounts, paid subscriptions, and advertising. Maria Pruz for VOA News, Washington.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.